I was alerted to this article today. It's morning at the moment, early morning. I'm sleeping well. Yeah, I was alerted to this article earlier today, and it's about this chef who is using a ketogenic diet, or has been using a ketogenic diet since 2015 when he was diagnosed of a low grade astrocytoma. So the headline is a bit sensationalist, as they tend to be, and there are a few, let's say, questionable um, statements made. However, I agree with the basic premise of the article, and it's not too bad. Um, Low grade astrocytoma brain tumors are likely to be more sensitive to the ketogenic diet, and this chef who's been applying the diet to himself is likely to, well, it's controversial, but likely to have more success, I believe, because he doesn't need to have, for a low grade brain tumor like this, you don't need to have chemotherapy and radiotherapy. And it's likely, as I say, it's likely to be more responsive to metabolic therapies because it's using less other fuels for energy. It's primarily glucose and glutamine. Um, the lower grade astrocytomas are definitely more glucose hogs. They don't appear to usually express other fuels, utilize other fuels as much. And another thing that made me think is just that when I was diagnosed, very few people were doing this. It's also just, I find it interesting in a way to look at chefs themselves and just the fact that they work in these very pressurized environments, and lots of young people with brain tumors appear to have that kind of environment that they're living or working in before they're diagnosed. It's quite interesting. Um, and also, they cook a lot with olive oil and vegetable oils, which are not good at all. I was interested in this. Um, his diet now contains organic grass-fed meat, butter, um, and omega-3 rich vegetables. I hope he's not cooking with those and that they're cold pressed. I'm not sure about the blueberries either. I would cut that out maybe. I think that the benefit from the blueberries actually comes from the skin. It's the kind of active ingredient that has the benefits. But I wouldn't have the blueberries because of the fructose. If you cut them out, you do see, if you're on a ketogenic diet and you cut them out, you do see that you get more favorable blood glucose and blood ketone readings on the, if you're assessing efficacy via the glucose ketone index, which is what I would advise brain cancer patients to do. Um, just gives you a guideline of what is likely to give you managed growth, or yeah, stable, controlled disease. And then you can hit it with other metabolic approaches that put pressure on those cells. So it's not just diet alone. But in terms of the diet, I feel like people who are relatively newly diagnosed and doing this and investigating it should really understand the nuance required for cancer management. It's different to the ketogenic diet for other conditions or weight loss or just general health. It's more, yeah, like I say, it's more nuanced. So you'd think about things like deuterium depletion, the omega-3 and 6 ratio, fasting, how much you need to restrict protein. You don't want just unlimited fat. It's not an all-you-can-eat fat diet as well. You're using fat as the fuel. So you'd also look at your body composition. You'd look at your um, if you have any extra adipose tissue that you can use for energy. So you'd need less fat on the plate, so you can use more fat from the body. And yeah, so I agree with most of this. Has some good stats about brain cancer, which is true. Um, Another thing that I was encouraged by was my oncologist, Mr. Kevin O'Neill, is mentioned here. He's also an excellent neurosurgeon, and we have a lot of discussions about the ketogenic diet and also deuterium depletion, which he's really getting into at the moment, which is encouraging because it's so important that patients do this properly and understand that you can have a ketogenic diet that's actually high in deuterium, and that's not good. The main mechanism of this diet, I keep going on about it, but it's really important, is that just a well formulated ketogenic diet, the main mechanism of action is that it depletes deuterium from the mitochondrial matrix water. And it also acts on an enzyme that is involved with tumor suppression called fumarate hydratase. So it restores function of fumarate hydratase, which is often inhibited in these cancers. And if you restore function of that, your mitochondria function better, and you can restore function, which is quite cool. And you use more metabolic water, so you actually and you produce more metabolic water, which is naturally deuterium depleted, and as a result, you actually drink less. So I know that my approach isn't great if I'm more thirsty and I'm drinking more. It's an indication that maybe I'm not adapted in that way. Maybe like if you are fat adapted, you can also be water adapted in that way. I don't know if that's a thing, but it's my hypothesis anyway. So yeah, my oncologist, Mr. Kevin O'Neill, he was mentioned quite a few times, quoted quite a few times in this article. Similar to me, he had well, I had a brain hemorrhage, but a stroke is quite similar. He had a stroke. But as I say, his tumor was a low grade brain tumor. I'd love to contact him actually. I might do that. Might go to his restaurant actually. He's opened this, or he has this restaurant in Leigh-on-Sea, I think it is, and he is serving ketogenic food now. So maybe I'll pay him a visit. Again, they talk about, as they often do in these articles, that the diet is working by starving tumors of energy. This is a bit of an oversimplification, but obviously, as a journalist communicating to the general public, you'll go over people's heads if you talk about how it has multiple mechanisms of action. It's not just about the glucose, and it's not even about the glucose directly. It's more indirectly, because we're talking more about the it's more about insulin. So how insulin impacts on glucose entering the cell. So you're managing insulin. And you often get people who say, oh, well, the brain needs glucose for energy, and those receptors will still be activated in such a way that you can't control these processes. However, you have conditions like GLUT1 deficiency syndrome, where these glucose transporters in the brain are not functioning properly. So these children with drug-resistant epilepsy are having status epilepticus, where they have multiple seizures because these transporters in the brain are not functioning properly. They can't, if they try to use glucose for energy as the primary fuel source, they have multiple life-threatening seizures. And when they go on ketogenic diets, they can control this because their whole metabolism changes and the brain is predominantly using fat for energy. So if anyone contests the efficacy of the diet for epilepsy, even if they're talking about brain tumor related epilepsy, we know that it's neuroprotective, and we know that these patients can stop having seizures. Obviously, any kind of oncologist has to say that you must do the diet as adjunct to conventional treatment with chemo and radiotherapy, not an alternative, because they have to. So funny looking at these headlines on the side. They're just complete nonsense, and then you have this story which is quite interesting. But it's that sensationalist journalism, and the Daily Mail is typical for this. Although they often have some interesting articles, so it's it's kind of amusing, isn't it? Going off on a tangent there, as I often do. But as I was mentioning with this, recommending this as an adjunct, not an alternative, there are patients who are doing it as an alternative, and they get very interesting results. We just can't recommend it because it wouldn't be ethical for a medical professional to do that. So they have to say that. And the mouse studies, it would be interesting for people to know more about KetoPet and the dogs, because they're doing this with dogs at the KetoPet Sanctuary in the US and having very interesting results. Ketogenic diet and hyperbaric oxygen therapy, and exercise as well, because dogs are very they have a very faster metabolism than humans, and they're panting all the time and running around outside exercising. So yeah, I found that interesting, and I'll try and go to his restaurant at some point. I think that would also be. He also was similar to me. He was bedbound for a long time. So the quality of life aspect is important, even if you discount the effects on the actual cancer. In his case, it was a more benign brain tumor because it was a low-grade brain tumor. But journalism is such that they like to sensationalize these things. However, I think this article's pretty good, and we don't know how he would have responded otherwise. I would make some amendments to his diet if I was to be a nutritionist, seeing him, even though I'm not a nutritionist. I'm qualified, but I choose not to go down that path for various reasons. And he had a seizure like me. It's very common. Very common to get diagnosed that way. I had a brain hemorrhage, and that caused me to have multiple seizures. And I had a few partial seizures before that, and then I just had loads of grand mal seizures. It was horrible. Anyway, I'm doing really well now, and I just thought I'd share that because I found it interesting.